Welcome to the Phoenix Prosperity Podcast, where wealth meets legacy. Join your host, Tim Fergestad, as we explore the journeys of Phoenix's finest to success and beyond.
Hello, this is Tim Fergestad. Thank you for joining us. Today I'm joined by Bob Maguire, founder and chairman of Biolab Holdings and the mind behind 3 biotech startups. Bob leads a team at the forefront of regenerative medicine, working with major universities and hospitals to create innovations that restore the body's natural ability to repair, recover, and thrive. Welcome to the show, Bob.
Thanks, Tim. I appreciate it.
You've worn a variety of hats in these different companies, and currently you're the chairman. Is that right?
Correct. I'm the chairman and founder of Biolab Holdings.
All right. So do you want to give us a background on how you got into that space directly,
Sure.
or where do you think is a good place to start?
So I went back to grad school. I got my executive MBA at Arizona State University at the W.P. Carey School of Business.
Okay.
I was the class president. People are texting me, where are we going to celebrate? It was the last day of school, April 27th, 2013. It was a Saturday at 5 p.m. I was eating a Jimmy John sandwich in one hand, texting in the other, driving with my knee. What could possibly go wrong, right?
Right.
So I went right into the guardrail going 70, flipped over, and then rolled 3 times down in the gully. I didn't have a scratch on me. And I remember the next day I was flying to Rochester, New York. It was a remote position, but VP of sales for a software company. And I remember asking myself, am I really doing anything to help people, to change people's lives? Or am I just saving them money? Because at the end of the day, when I'm retired or dead, no one's going to remember me. And I really wanted to help people and make a difference. And I figured that was a great second chance.
Okay. So it was a bit of a existential crisis, or an awakening with a near-death experience, made you wonder what's the purpose?
It was interesting because it really got me thinking about, am I really making a difference? And a lot of people feel, say someone was in the car with me, probably my dad, who's been gone since 1991. But, I definitely had more juice in the tank, and it was not time for me to go. I literally didn't have a scratch on me, so everything
Wow.
worked out well.
Wow. Okay. Okay. Wow. So you didn't take the position in Rochester. You
I
decided
did.
to. Oh, you did.
So I was VP of sales for a billing company, a software company, and I'd been in software and business equipment my whole life. As I always joke, I sold on a little island back east called Manhattan for 8 years. So you learn quickly if sales is for you or not. I'd been in the World Trade Center thousands of times, had actually gone there for my high school dinner graduation with my mother's boss. We went to Windows on the World. I've got a lot of experience, a lot of knowledge. But yeah, late in the game, I went back. I decided to sharpen my tools, go back to grad school, get my MBA, and then started another biotech company.
Okay. How was the MBA experience at that stage?
Great, because I think it helped fill in the gaps that I had. And I
Okay.
know that I'm not perfect. I know that I don't know everything. And I think that's what helped me be successful, is that I hired people that were smarter than me, that were PhDs, that were MDs, so on, that could get the job done.
Right.
And they say if you're the smartest person in the room, you're in the wrong room. I truly believe that. So I feel that I gained a lot because I was humble and I had a lot of humility, and I knew that I didn't know everything. And I think that my being naive and my naivety, led me to be successful and disruptive, because I didn't care what people thought. I didn't know what the status quo was. I have MDs and PhDs that come up to me every day and they're like, how did you pull this off? What were you thinking? I didn't know better. And I think that
You hadn't been taught limiting beliefs.
exactly. That's exactly right, Tim.
Okay, excellent, excellent. Well, to your point on education, I've heard repeatedly different variations of this where the A students work for the B students at the company owned by the C students, and in fact, one of my uh, real estate investor colleagues here in the valley, one of his Lamborghini's license plates has the license plate C student on it, which I always enjoyed.
I was a C student in high school. I never studied. I was a played basketball. I was a jock. I am from the state of Connecticut. I was one of the best players in the state. I didn't study. I have a twin brother that studied. He was, ranked in the class. Was a straight A student. I wasn't. I didn't care about that. It didn't matter to me. Going back to grad school, I was an A student, but because I was paying for it, it was different than back in the day when you just go and you're expected to go. And so it
Right.
definitely made a difference. And I definitely have ADD, ADHD. I was on Vyvanse, which helped me focus,
Hmm.
which without it, I would have been a B or C student and so on.
Hmm.
But it allowed
Okay.
me to really focus on getting the job done and studying and so on.
Okay. Okay. Very cool. That's yeah. All sorts of lessons there. Um, so what was the progression of the companies you were a part of, and how did this mindset shape each of those?
So the first company I started was back in grad school in about 2012.
Hmm.
I was 51 at the time,
Okay.
which was late in the game, but I was divorced. My daughter had moved out. I had nothing to lose. So that's
Okay.
the way I saw it. I was going to go for it. And I think a lot of times you just have to go for it and not care what people think. So the first company was a distributor of stem cell products, regenerative medicine. The second company, Axolotl Biologics, was a stem cell regenerative medicine company, but we manufactured our own product. I was pushed out of that company and 21 days later filed the paperwork to become Biolab Sciences, which is now Biolab Holdings. So we've been around 7.5 years at this point, and we pivoted from amniotic fluid, regenerative medicine, to wound care, skin substitute, so on.
Okay. Very interesting. What was the connection to that space to regenerative medicine?
There really wasn't. It was just something I started researching. I had a classmate in grad school that had been a spinal surgeon that was interested in the regenerative medicine space, and I think that's
Okay.
how I started doing research and getting interested in it and looking down that path.
Okay. Okay. What were some of the bigger challenges getting into that space at that time,
Um,
even?
Well, starting any business is hard. People don't realize that there's a lot that has to be done. You've got to set up bank accounts. You've got to deal with regulation. You've got to deal with CMS, the Center for Medicare Medicaid Services, the FDA, the Food and Drug Administration. There's so many things that need to be done. You need to set up a bank account. You need to do different things. You've got people that invest in the company. We didn't have many. We only had about $1 million in investment, which wasn't much. We didn't take on any debt. So today we're debt free, and
Nice.
we're we should be able to move forward with the sale here shortly. But
Okay.
um,
Excellent.
the key thing was not caring what people thought. There were a lot of naysayers that said you can't do it. You don't have a medical background. You're not a PhD. You're not this. You're not that. The very same people that called back years later asking for jobs. So.
Wow. Yeah. Yeah. There's some lessons there too. That's got to be scary, right? Or is this fall into the category of you didn't know how challenging it would be, so
I didn't
it
know
wasn't
how
scary?
challenging. Yeah, I didn't know how challenging it would be, Tim. It was definitely a lot. Looking back, I'm like, oh my God, I can't believe that I did this and we got to this point. But it was a lot of work. It was a lot of time, a lot of going without paychecks, a lot
Hmm.
of, my wife and I had bought a house in Fountain Hills, Arizona.
Hmm.
We ended up walking away from it so we could make payroll.
Oh
Because to
boy.
me, the most important thing was paying our people to make sure, because I didn't just see it as individuals, I saw it as families. And I wanted to make sure that we paid the people what we agreed to and
Hmm.
what was on paper, but also to make sure that their families got the money because I know they needed it for mortgage, for rent, for food, for whatever they needed it for. But I was very committed to them in that sense, and I think that, but there was a lot of pain in the beginning. So
Okay. Okay. So this was Biolab Sciences at the time?
yes. Uh-huh.
Okay. Okay. And um what products were you guys focusing on at the time?
So we sold an amniotic product called Fluid Flow,
Okay.
and the FDA had a 3-year period from November of 2017 through November of 2020 where you could sell the product without a biologics license application, a BLA, or a PMA or so on, marketing application.
Okay.
And we sold it, and then they extended it to the end of May. And then we had to unfortunately pull the product off the market a little bit past the end of May because the FDA said that amniotic fluid no longer is considered a biologic but a drug.
Wow. So that's a tough space to be in when you can get legislated out of business, right? That's
You never know. We're currently waiting on LCD, local cost determinations by CMS, where they're dropping. Currently, they have a process of average sales price, ASP, that we put in what we sold our product for the previous quarter, and then CMS determines your costs that they will reimburse for based on the ASP application, but they're going to a flat model of $127 a square centimeter. This is CMS. Dr. Oz runs it.
okay.
Um, we don't know that it will go through. We won't know until they typically will send an email at 3:15 a.m. January 1st and state that they're not going to have the LCDs. They're going to wait a whole year and apply for an NCD, a national cost determination. So we just have to wait and see what happens. But it is gut wrenching with the regulatory and so on, because you never know what's going to happen. I think the government is being short-sighted. I think there are a lot of people out there. So we provide wound covering or skin substitutes for people that have chronic non-healing wounds, pressure
Right.
ulcers, diabetic foot ulcers, so on. And the benefit is helping the people heal. So to me, it was never about money or awards or anything. It was about helping people. We would donate product, and we still do, to people that don't have insurance or have coverage or so on. And we do that because we feel it's the right thing to do to help people, help humans heal. So
Sure. Sure. So what is it about the United States that seems to be such a slow adopter now? Is it safety or is it bureaucracy or a little both?
I think a lot of it's bureaucracy and it's basically money. Everyone's worried about, how much money they're going to get or what's in it for them. I look at, we're not in Europe at this point. We're just in the lower 48. We
Okay.
sell quite a bit here. We sell to outpatient facilities, mobile physicians, so on. We're not inpatient, which is hospitals. We're not VA. We're not DOD. We're not international. but I feel that a lot of it is bureaucracy, and government officials looking at what's in it for me versus what's best for the people. So,
Okay, right. So what have been the bigger challenges uh, through COVID and all that, and in regenerative medicine? Did those kind of, I don't know, it's like tissue, because well, I guess it depends on how you're sourcing these, right?
so
Was that an issue?
we have donor groups that we work with that source placentas out of hospitals for mothers that have C-sections. So
Okay.
legally, they cannot pay the patient to donate. So it's a very high profit margin for them,
Okay.
or very high EBITDA, because basically they're getting the product. We pay $1,500 to $2,000 per placenta. And then within our one of our labs, it's cut up into pieces and packaged and so on, terminally sterilized, and then we ship out based on orders to distributors who sell to the physicians. So that's how we operate.
Okay. Okay. Um, so when was the transition from sciences to holdings? Was that post COVID?
November 1st of 2023.
Okay. Okay. So it was post COVID. So you guys managed to get through that phase
So
and
a few of us showed up at the office during COVID, and
okay.
we resold COVID test kits to people. That lasted about 2 months, 3 months, and then COVID ended, and then you know, we had people coming in, Tim, that promised to buy 700 million tests and buy this and that, and it was just ludicrous. So, and then we pivoted into, we had already been producing a wound care product or skin substitute, and we expanded that because we saw that as the opportunity to help people.
Okay. Okay. Is that related to the axolotl work?
Yeah, so they do some of that. They do the fluid. They did the fluid. They don't do it now. They do the skin substitutes, but they do it on a much smaller scale. We do it on a much larger scale. We have 13 clinical trials going on as we speak. So the benefit is we'll have what's called a 510(k) from the FDA. And what a 510(k) is basically saying that they'll approve a product that is equivalent to or better than something they've already approved that already exists.
Okay.
So we're waiting to hear back on those, but it should be Q1 of 2026 when we
Oh,
start
okay.
hearing back on those. Yep. And
Okay. That's
it's a lot of
exciting.
money. It's a lot of money to conduct the clinical trials, a lot of work. I know we have outside groups that we've contracted with. I know we have a lot of internal people that are involved. So it's definitely a lot of work and a lot of
Sure. Sure.
money and a lot of time. So
Yes. Yeah. And yeah, those all go together. Um, okay. That's all cool. Very exciting. Thank you for sharing that. That it sounds like that's all been great. N- with challenges, obviously, but
with challenges, yes. But I'm
but
glad that I did it because we help tens of thousands of people annually. And when I hear some of the stories and I tell the people in the labs, you can literally see tears in their eyes. You know, someone that couldn't walk or someone that couldn't wear socks or pants or whatever that can now walk, and whether they're working or playing golf or whatever it is that they want to do, they're able to do it where they couldn't
right.
do it before.
That's incredibly impactful and meaningful stuff. So
Yeah,
that's yeah, that's something that a lot of people's work doesn't have. And so this is part of your focus at the time of your rollover, right? That you wanted to make
yes.
sure you did something
To
meaningful.
help people to make a difference to that really matters. And I think keeping people alive matters more than saving them a few bucks here and there.
Right. Right. But bucks here and there are kind of how you pay for things. So yeah, it's balance, right? I mean, it's great that you've been able to do that. Um, so what are your thoughts on creating income outside of your business, right? If you once you're transitioning less and less, you don't want to spend as much of
So,
your time doing
so
that.
I've been pretty much retired since January of 2024. So
Okay,
almost two
congrats.
years. Thank you. And what I'm doing is, I own our house in Scottsdale. We have a house in Flagstaff. We have a house in Tucson. There's
Okay,
no
I like real
mortgage.
estate. I like
Yeah, I
that.
know you do. And, there's no mortgage. Everything's paid off. Our cars, everything's paid off. So, the goal moving forward is using teams of people that work in wealth management to help us grow the money. So, because having it just sit there, it makes them money, but doesn't make us any money. So,
Right, right. For sure, for sure. That's kind of a lot of what I do nowadays is just sort of help people find the best return on their money, right? So they don't want to have to spend their time doing it. And that's a lot of our passive real estate investments, which is nice. And I do have different affiliates. I just had somebody on the podcast earlier today. I do Wednesdays are kind of my podcast days, and who does gold and silver. He's been doing it for 30 years, right? And it's just a
oh,
little part of it's like 70% of the top 1% have that in their portfolio for a reason, right? Most people don't. 95% of people don't have, precious metals, for example. But it's interesting to see the diversification people do and the different reasons for protecting their portfolio.
it's funny you say that. I was at a event last week in Palm Desert for the Entrepreneur of the Year, Ernst& Young. Vince Vaughn was one of the people being interviewed. And he
Okay.
talked about when he first started making money that he bought gold, he bought farms, he bought, he was getting into all
Hard
that.
assets.
Yeah, so it was interesting, very interesting.
Okay. Yeah. Yeah. Uh, it depends on your goals, right? A lot of my investors are business owners or physicians who are in growth phase still. They don't want cash flow. They're not trying to buy back their time. They just want to grow their nest egg, But then I'm having more and more of them who are looking for cash flow or passive income, right? To start paying off. Well, and then we have a lot of our stuff as a mix, right? Which is nice.
Yeah,
And we just closed today. It's November 19th, Wednesday, November 19th, when we're filming this one. And we just closed out another one in Texas. This is a apartment community in North San Antonio. And what's particularly unique about that one was partly because of the bonus depreciation coming back, that we have over 70% paper losses for our investors for 2025 this year, which is great. For people with passive income, they can, get a big tax break on that.
congratulations, that's great.
Thank you. Yeah, it's always
Yeah,
nice to close on another good deal.
yeah.
Okay, here's a question I have as we start wrapping things up. Have you done anything in the last year that's changed your life?
Um, paid off this house, bought the Flagstaff house.
Okay,
I think that was life changing in getting me security individually.
okay,
Um, so I think that was good. Um, the next thing I'd like to go after is cancer because both my parents died from that. So we'll
okay.
see what happens there. But I need to get all of the knowledge that I picked up out of my head and go back to being naive Bob versus knowledgeable Bob.
Right, right. Yeah, that's there's a great story. I don't remember. I should look this one up. It's worth knowing. The famous math problem that the teacher wrote. It was sort of the premise for the Goodwill Hunting
Yep,
scene.
yep,
That is based on a true story where the guy was late to class and he came in and he thought it was homework when really it was a thought experiment saying here's a problem that's no one ever been able to solve, and he didn't know it was unsolvable, so he solved it.
yeah, right. Because he didn't know.
Yep,
No one told him he couldn't do it.
exactly,
Yeah,
exactly.
that makes
Awesome.
a big difference. I'll
It
tell you,
does.
being naive and not knowing the ins and outs and not being told you can't do this, you can't do that, I really feel helped me tremendously and really made a big difference in not having people telling me that, oh, well, you can't deal with CMS, you've never dealt with them, you don't understand how they operate, or you
Right.
can't deal with the FDA. I was just honest with them and just here it is, and this is what we have, and this is what they're like, oh, okay. So
Awesome.
they might have been confused by my naivety,
You're
but
ex-
but everything worked out. So
awesome. Awesome. Yeah, that's I love it. That's a great story, Bob. Thank you. Um, yeah, my father died of pancreatic cancer, and his father died of pancreatic cancer. So, um, those are things that are on the next wave and worthy of absolute focus and study. So, I think that's great that you're interested in tackling on another
well,
project.
get checked out. I know a lot of people that have had cancer and passed
Mhm.
from it, unfortunately. But there's your sign there. Your dad had it, your grandfather
Right.
had it.
Yep.
And
Yep.
so you just want to get checked out because with the pancreas, we usually don't find out till we're stage 4 and it's too
Right.
late. So
Right.
if there are no
Yeah.
symptoms, really.
Right. That's why it's so deadly is people don't catch it till it's too late because there are no
Right.
symptoms. So I get scanned every year and now,
Good.
right, which is good. And so far I'm good.
Good.
Thank you. Thank you. All right. I sometimes like to talk about impact and legacy plans. We've talked about quite a bit, and a lot of your focus has had a lot of big impacts, so that's great. One question I was wondering about is how much of that is national versus like regional. How much of it is Arizona focused?
No, it's all national. We're not Arizona focused or based. We're definitely
Okay.
nationally based. We have 6 regional vice presidents of sale
Okay.
in the Southwest, Northwest, North Central, South Central, Northeast, Southeast.
Okay.
And the benefit is they manage our distributors. They make sure that our product gets out to the right people. We have shipping and distribution here to send the product out, but the orders come in every day, quite a few. So it's
Okay.
been very
Excellent.
good. And, the key of having the people in the positions of the VP of sales is that they can make a difference and bring on distributors. And, when we started, my business partner, who's now president and CEO of the company, said back in the day when we started, everyone in the company was in on the weekly executive meeting, where now we just have the executives in. So
Right.
we've
Right.
grown and changed.
Yeah. You have over 100 people there
Yeah,
now?
about
Wow. That's
120. Yep.
that's great. That's great. It's awesome. Congrats. So, as we wrap things up here, what do you wish you knew sooner about building wealth and success earlier in your career?
I wish I took action 20, 30 years ago. I wish I knew what I knew now. But I have a saying, it is what it is. My brother
Sure.
hates that saying, but I say it is what it is, and better late than never. But I wish that when I was back in my 30s, that I decided to go for it. But I don't know that regenerative medicine really existed back then. So there are a lot of reasons I could have done things back then, but didn't. Um, Especially because I don't know that the industry existed for regenerative medicine.
Right.
And, I have told my daughter and son-in-law, they're 30, when their kids grow up, my grandkids, there'll probably be industries that exist then that don't exist today. I mean,
Yep.
AI, artificial intelligence, has come up
Right.
out of nowhere and is everywhere. And, it's kind of to the point like I better learn that quickly because a lot of other people know it and talk about it and use it. There was someone talking about writing a book, and she saved 30% of her time using AI to do research for her because it was able to just pull up the information. And, dating myself, I used to have to ride my bicycle 5 miles to the library, wrap my books in saran wrap, put them in a backpack, and, in case it would rain, which it would. But it's just very different. And kids today, they don't know what the Dewey Decimal System is. They don't
No.
understand any of that. So, but I think AI is the next front, and I'm sure there will be other things after that just like there was the .com in the 2000s and regenerative medicine and now AI, and there'll be other things that come up.
Right.
So
Kind of what you kind of what you said at the beginning of the call, probably take action, right? And just to stay on top of things and keep
go after it, just do it. Don't wait,
right,
don't wait, don't waste time.
right,
And the worst thing is, you make a mistake, you start over. Younger people that want to move, I'm like, move. If you don't like it, just move back. I mean, it's that
right,
simple. And they're like, yeah, I never thought of it that way. You know, Nothing is final. And, Thomas Edison had a saying that I truly believe in. So many people are so close to success that they give up right before that
right,
because they don't realize how close they are and they end up giving up before
right,
that. And it's a shame because then, yeah, and I've had a ton of failures that I've learned from. And I think they're good failures because you learn from them. They're bad failures if you don't learn from them. So, where I would say, oh my God, I would never do that again, or that was horrible. So,
right. But they all shaped you.
yeah, they do.
Yep. Okay, great. Bob, if people would like to connect with you or learn more, where can they go? What should they do?
So my mobile is anyone can call me with questions 480-688-5760. My email is bmaguire, Maguire at biolabholdings.net, net. That's how they can get a hold of me.
Okay,
Happy to
great.
talk to anybody.
All right. Thank you. Thank you very much. All right. Well, thank you everybody for listening and watching. Thank you very much, Bob Maguire, for joining me today and sharing your story and insights and success and biotech industry here in Phoenix.
Thanks, Tim. I appreciate it.
Inspired by our guests? Visit phoenixprosperitypodcast.com/guest and join us on the show and share your success story with Tim. The spotlight awaits.